tonsillectomy and adenoidectomy surgery is now over. Now what? One thing that you can expect after surgery is pain. This is a bad sore throat that will last roughly 7 to 10 days after surgery. During this time, you won't go to school for about 1 week. Sometimes you could also have bad breath, fevers, earache, or white debris where the tonsils were. All of these things after surgery is completely okay and expected. That's just your mouth healing. There are 3 very important things that you must remember. The first important thing is how to control the pain. Taking ibuprofen and Tylenol together every 6 hours for the first 5 days will control the pain. This will keep your pain tolerable. After the initial 5 days, the ibuprofen and Tylenol can be used as needed. Sometimes the pain can worsen a week after surgery when the scab may fall off. If this happens, you can return to taking ibuprofen and Tylenol together again. In this case, take the medicines, especially at night and in the morning when your pain is the most intense from your mouth being dry. The second very important thing is hydration. It is very important that you drink lots of liquids. The hydration will help with pain and will also help to prevent the 5% risk of bleeding after surgery. Liquids you can drink are water, juices, broths, pudding, jello, and yogurt. Don't forget, popsicles and ice cream are liquids too. The pain will be worse when your mouth is dry, so be sure to drink lots of liquids and often. The third important thing is pooping. It is important that you poop once per day or at least every other day after surgery. Sometimes a combination of the anesthetic and pain may cause you not to want to go. If this happens, you can try some prune juice or over-the-counter stool softeners. Okay, well, what about eating? You can eat. Soft foods are usually preferred. These are things that are not too hot in temperature, not too spicy, and not too scratchy. Most children will want to eat something, but again, the most important thing is to stay very well hydrated with lots and lots of liquids. Okay, what if you bleed after your surgery? There is a 5% risk that you can bleed up to 10 days after surgery. The reason this may happen is that the scab in your mouth may have dried and cracked and bled. This is why it is very important to drink lots of liquids. Blood streaked in your saliva is okay, but not more than a tablespoon or clots. If this happens, then you should come to the emergency room so we can examine you and help fix your bleeding.